Well, travelers can continue to go maskless for the time being. A federal judge in Florida, of course, struck down the federal mask mandate for public transportation on Monday, saying it was unlawful. The Department of Justice says it will appeal the ruling only if the CDC says the order is still required for public health. So no word yet on when that decision might come.
And we should point out new numbers from the state show cases are ticking back up here in Michigan. The state now reporting 10,474 new cases over the past week. That averages out to about 1,496 cases per day, 78 new deaths also being reported over the past week as well. And of course, those new case numbers do not include the results of any of those home tests.
We know that's a lot of folks these days. This uptick comes as the CDC and the FDA trying to chart a course for COVID vaccines moving forward. So for more on both these stories, we bring in Dr. Frank McGeorge with your reaction to these new numbers, Doc.
Yeah, Sandra and Devin, it doesn't actually surprise me that new case numbers are where they are, given that the circulation of a more contagious variant, BA2, and another even more contagious variant, BA2.121, which we've seen at Henry Ford Health, is going on. Now, personally, I haven't seen any indication of an uptick in hospitalizations or more severe disease yet, and I think that's really important because we're in a different place right now with COVID. The circulating variant may be more contagious, but it is less dangerous, especially to people who are vaccinated or recently infected. Now, new case numbers just are not as impactful to me as a rise in serious illness would be, but unfortunately that is in fact a lagging indicator. Now, as for the vaccine situation, the CDC's Advisory Committee on Immunization Practices met for several hours today, and they discussed potential frameworks for future booster doses, including timing and whether or not the vaccines should be updated to protect against newer variants. Now, many experts actually expressed the desire for a simple plan, but they acknowledged that there are still many factors we just don't know yet. There was no vote at today's meeting, but the CDC and FDA are expected to use the discussion to really guide their next steps. Now, some of the experts also pushed for continued development of vaccines that could be more effective at preventing infections as well as reducing the risk of hospitalizations and death.
Yeah. Doc, do we have an update yet on the vaccine for children under the age of 5? A lot of people have been waiting for that.
Yeah, there was no update actually, but at the public comment session today, nearly all of the comments were from parents who urged the FDA to authorize a vaccine for young children immediately. Yeah. There clearly is a high level of frustration at the delay, and the FDA really could take some action on this in May if the data is there to support it.
Yeah. All right, Frank.